just shows you the interest in this subject in Gibraltar and the willingness to work together to understand it, explore it further, and try and work out what does that mean in the future. We are seeing a general increase in special educational needs. Some of the risk factors are well established and well known. For example, there is a genetic risk if you yourself have attention deficit disorder or hyperactivity. There's a risk there, there's a genetic risk that your children will have a similar condition. We know that a lot of adults have never been diagnosed, so it might come as a bit of a surprise as an adult to think, gosh, could my genes have had an impact on my child's diagnosis? There are other factors relating to maternal risk factors, for example, maternal obesity, smoking in pregnancy, and this is why we're really focusing on trying to encourage people planning to become pregnant to be as healthy as they possibly can be before they become pregnant.
Dr. Carter believes it's too early to comment on whether this trend will continue or whether the numbers will even out. She says that while wider understanding amongst educational and health professionals has certainly contributed to a rise in numbers, many environmental factors also contribute.
So the report generated 4 recommendations. The first one about trying to support our mums to be as healthy as they possibly can during pregnancy. The second one related to strengthening parenting skills and supporting our parents in terms of, especially in early years, because one of the third recommendations was trying to limit screen time that especially young children have, and to support parents that there are other ways to interact with children. And the final one was very much for the Department of Education about that inclusive educational approach and supporting the children where possible remain in the mainstream educational setting, whilst absolutely accepting for some children St Martin's is the best location for them.
Acceptance and adaptability are high priority, but Dr. Carter is also keen to highlight the avoidable factors which parents in particular should be keeping in mind.
We're hoping that this study raises awareness of some of the modifiable risk factors, and this is, for example, not smoking in pregnancy, maintaining a healthy weight, and this is why we've been working very closely with maternity colleagues, strengthening that smoking cessation support during pregnancy. You are far more likely to have a successful quit attempt with support. But success for this project also looks like these are the adults of tomorrow. What are the implications of this report for the future workforce of the future in Gibraltar? How can we support and enable these individuals to lead fulfilling, productive and economically prosperous adult lives? And that's why this report is very much linking into the youth strategy work and looking at future employment opportunities for individuals with special educational needs.